Take care.
I need your birth month and date, just a month and the day.
Okay, it's January 31st, 1962.
How are you? Good. I saw your dad from Vienna, Spain, and you have some friends.
Hey, it's Trey, and I'm at a local pharmacy, bracing for a shot in the arm. So, just let you know I can be a big baby here.
No, you're not. No, you are not.
I've gotten 3 vaccines in the last month: flu, COVID, and now shingles. I can't say I love getting them, but I am grateful that I have access to them. And with every sore arm, I've been thinking more and more about a story produced this year by my colleague at West Virginia Public Broadcasting. Emily Rice is our Appalachian health news reporter. And a few months ago, she produced a story called West Virginia's Vaccine Divide. And it's about a bill designed to loosen the state's vaccination requirements. A bill that nearly became law in the state.
I've done, countless stories about, hey, get your vaccines. Here's where you can get your vaccines. But I hadn't really delved into, should you get your vaccines? There's been conversation around the legislature among lawmakers to try to weaken vaccine laws for at least 2 or 3 years. West Virginia has what a lot of immunologists call the quote-unquote gold standard when it comes to vaccination policies, school entry policies, that is.
Meaning our state's laws have very little wiggle room. Only a medical exemption will get you out of school vaccine requirements. But a recent legislative proposal would have changed that. The bill would exempt some kids from state vaccination requirements.
This was one that garnered a lot of discussion pretty much as soon as it was introduced.
The proposal would have removed vaccination requirements for virtual public schools, including homeschool students. And it would have allowed private school and parochial schools to set their own standards. In the House Health and Human Services Committee, support for the proposal was split down party lines. Republican delegate Laura Kimball, who drafted the bill, called the state's existing vaccine requirement for virtual students absurd.
But then we have the Democrats who said vaccines are an important way to curb public health emergencies.
Those supporting the proposal say some parents want relief from, quote, oppressive compulsory vaccination laws. From that debate, one change emerged. Virtual learners would have to be vaccinated if they wanted to play sports with other kids.
By the time it made it to the Senate Health Committee, there was a room full of doctors in white coats in the audience, kind of showing a almost solidarity with the vaccine laws that already exist in West Virginia.
Emily remembers Senator Mike Maroney introducing that bill. He's a radiologist. And recently, he lost a primary race where his opponent was backed by the same group that opposes current vaccination requirements.
And when he presented it, he said that his Hippocratic oath wouldn't allow him to, present it without saying that he does not recommend it pass, but his committee does. I had never seen somebody introduce a bill in that way that I personally disagree with this, but my committee requires me to.
Which brings us back to the group of parent activists.
They're now going under the name of West Virginians for Health Freedom.
Was there a spokesperson of this group?
The one that I was able to get in contact with, her name is Chanda Adkins.
Well, health freedom is the ability to live out your journey and your health in the way you see fit.
Adkins is a former state delegate and pharmacist.
When I think of West Virginia, I don't think of Jennifer Garner, although she's lovely. I think about people, they might be unhealthy, but these are people who love their kids love cookouts, love their land, and I mean, obviously they love God and guns and babies, but I just think West Virginia is just such a wonderful soul of a state. I just don't want to see it dissolve into a prison.
Her main argument is for the option of choice.
We see people that smoke. We could say, hey, that's not good for you, but do they have the choice to smoke the cigarette or not, right? It's a choice for their own health. They choose maybe something we might see as not as a healthy option. They have the freedom to choose to get the information and to make an informed choice decision about that. And that's the freedom in it. Not every medication and not every medical procedure is right for everyone.
Ultimately, the bill passed through the legislature, but it did not become law. Governor Jim Justice vetoed the bill, much to the celebration of doctors across the state. But for me, this story isn't only about the debate over the vaccination bill. It's about how a proposal like this, in a state with West Virginia's robust vaccine history, found itself on the governor's desk at all. Coming up, we'll hear from some of the people involved in the continuing fight over vaccination laws in America. From West Virginia Public Broadcasting and PRX, this is Us and Them. I'm Trey Kay. Now just tell me what you had for breakfast.
This morning I did not have anything for breakfast.
You're a doctor. Aren't you supposed to
Black coffee.
Okay, all right. That's Dr. Stephen Eschenauer.
I am the health officer for the Canal Charleston Health Department right here in Charleston, West Virginia.
Can you tell me how the story got to you? How did you find out about the bill?
I was very involved as a public health officer with most all the bills that went through either the House or the Senate that involved immunizations. It's part of the job because my job is to be an advocate for the greater people. West Virginia already has very poor health outcomes overall as far as various disease. But this is one area where we lead.
And when it came time to testify against the bill, his pitch centered on one phrase.
Not the few, but the many. That is what public health is about.
Dr. Eschenauer took his public message to state lawmakers in the House and Senate. But he didn't stop there. He took private meetings.
Talked to many legislators one-on-one, governor's chief of staff.
He talked to the media.
Similar to this interview, for both television, print, radio.
When health experts talk about a bill like this, they tend to bring up long-term impacts. Over time, if fewer people get vaccinated, infectious diseases can spread to more people, and illnesses like the measles can become an increasingly bigger threat. This year, there's already been a rise in measles cases nationally. So far, 271 people nationwide have contracted the disease. That's almost 5 times more than last year. And just as West Virginia's vaccine bill made it through the legislature last spring, the state had its own scare with the measles.
The way it played out in the Mountain State is there was an individual that was under-immunized, meaning they had not completed the immunization course, so they were still susceptible to the disease. They had left the state, contracted the disease, and came back. That individual exposed approximately 150 people to the disease, but fortunately, due to the high vaccination rate we have here, we did not see an outbreak.
But the population who currently makes or breaks immunity to diseases like the measles are preschool children who haven't yet faced West Virginia's strict vaccination requirements.
We only have about 2 out of 3 children are actually fully immunized against the common childhood diseases before school starts. It's when children go to school that is when the laws are effective because they are required to go to school. So when those children register for kindergarten and the school nurse reviews their records, they identify all the deficiencies they have and they can start getting those childhood immunizations. Most are under-immunized. So we go from dead last to number 1 in the country. If we remove that requirement for immunizations, we will soon likely be, given that only about 56% of parents actually had all of the immunizations given to their children before school started. Imagine a measles outbreak at a child care center with preschoolers, of which only 56% on average across our state are immunized. That would be devastating. as many as 1 in 3 of those children would have to be hospitalized. How quickly could you overrun a healthcare system? We saw this happen in Ohio. It was very devastating, expensive financially, the hospitals trying to manage highly infectious patients, and the effect that it has on those who cannot be immunized.
Were most people who either are homeschooling or are involved in private schools, were they all basically on board for this? Were they wanting this change?
So that's the way it was sold, but that was also an assumption. As they found out when a number of those private school entities, the largest of which was the Catholic Church, came out and said, we are not in favor of this. We want our children to be immunized, and we will still follow West Virginia immunization guidelines.
Did you know that it was going to pass? Were you aware?
Oh, absolutely. Oh, yeah, the count had already been done. You knew the bill was going to pass. So the only way to win that war at that time was via the governor.
What were those conversations like? I mean, can you say?
People want freedom. They don't want to be told by the government that they need to have an immunizations. The health of the community doesn't matter. It's the rights of the individual should always supersede the health of the children in our schools or in our community. That the government telling us to do something is not what West Virginians want.
How many times have I heard that phrase since starting this show? But the idea that some Americans oppose a public health mandate is far from new. And it didn't come from the Revolution or the Civil Rights Movement or any other tumultuous moment in our history. American vaccine hesitancy was imported.
It actually starts with the story of the very first vaccine.
That's Elena Conis. She's a writer and historian of medical and public health at UC Berkeley.
The very first vaccine was invented at the very end of the 18th century, the 1790s, and it was a vaccine against smallpox. When this first smallpox vaccine was developed, European nations started to say, hold on, here's something so powerful. We can actually stop smallpox outbreaks if we require people to get the smallpox vaccine. So as long as we have had vaccination laws or regulations, we have had members of the public saying, hold on, no. We want to make a decision for ourselves. Or in some cases, they argued it should be God's decision.
Meanwhile, in the U.S.,
we had very, very few locales that had bothered to make vaccination mandatory. People could decide if they wanted the smallpox vaccine or if they didn't want it. But around the 1850s, 1860s, as cities started to grow and as the U.S. started to become more industrialized, a handful of these growing cities were facing outbreaks of different infectious diseases. And so some of these cities created boards of health, and they sat down and decided what powers these boards of health should have.
Back in England, anti-vaccine activists were gaining momentum.
William Tebb, an Englishman who was prominent in the anti-vaccine movement in England, comes to the U.S. and is really influential in inspiring some of those groups to be founded here. So by the turn of the 20th century, what we have in the U.S. is a couple of things that are important here: a network of established anti-vaccine groups, more vaccine mandates, more smallpox, and a robust progressive movement.
The progressives were all about social reform. Cleaner cities, better jobs, more education.
But there were some individuals who were self-identified progressives, Laura Little is one of them, who saw their cause as protecting the public from things that weren't necessarily safe for them. She had witnessed what she believed was a very severe and ultimately fatal vaccine reaction in her son. That mobilized her to become an outspoken vaccine critic.
She, along with others, ended up successfully lobbying local governments to remove childhood vaccine mandates.
It really wasn't until well into the 20th century that we had really a full spectrum of vaccines that were being widely administered to large numbers of the public. We came out of the Second World War with a kind of different attitude toward science, which was given a lot of credit for helping the Allies win the war. And as part of that, a different attitude toward medicine.
We had new antibiotics, new disease treatments, and new vaccines.
We were also, after the war, facing a worsening polio epidemic.
Part of living, too, I've been reminded, is the need to breathe. I've found that a man can drown in a sea of air.
Polio was paralyzing about 30,000 children a year in the U.S. and killing around 1,000.
Polio had first appeared in the U.S. in the early 20th century, but outbreaks were getting worse and worse.
When he can't breathe, his breathing must be done for him by an iron lung. And for weeks, this was my life, my home, for I am a victim of paralytic polio.
Researchers in government and in academia agreed we needed more treatments and prevention.
This is your world, bounded by the edge of this small mirror.
FDR himself ran for president as a polio survivor. While in the White House, his administration tied supporting his presidency with supporting its research against polio.
The research effort was spearheaded by this national organization that was actually started by Franklin Roosevelt and his close friend and colleague Basil O'Connor.
Many polio victims are not confined to iron lungs, but even in a wheelchair, yours is a limited world. At times, you're an outsider, not because you are thoughtlessly left out of things, but because you no longer can take part. You are a spectator of life.
There was so much public buy-in to the National Foundation for Infantile Paralysis. Many communities felt like they had personally invested in the search for a polio vaccine. By the time the National Foundation announced the scientists that it had supported had created a vaccine, people felt like that was, to some extent, their win too.
The tragedy of paralytic polio can be prevented in individuals protected by all 3 recommended doses of polio vaccine.
Perhaps you've seen historic pictures of people lined up at their local schools, supermarkets, and clinics once the vaccine became available.
We had spent the war years listening to stories on the news and the media, on the radio and newspapers, everywhere about how America's scientific expertise was turning it into a global superpower. The polio vaccine was one demonstration of America's superpower capabilities. There were some people who said, oh, we better mandate this. And others said, let's just make it available and see who gets it. And that strategy of making it available actually got enough people vaccinated that it drove polio rates way down within the first few years after the vaccine was available.
By the 1960s, people had grown complacent with vaccination, and cases were rising again.
And at the same time, we're going through a massive cultural and social change in this country. The rise of the counterculture, anti-authoritarian social movements, second wave feminism, and all kinds of rights-based movements that cultivate a practice of really questioning authority and poking holes in all of that public trust in science of the immediate post-war movement. Right at the moment that health officials were saying, let's use mandates more, the public was saying, trust authorities less. And eventually, by the end of the 70s, right when we finally have probably the biggest network of vaccine mandates that had ever been put in place in this country, we have a public that's saying, hold on, what's in these vaccines and why are we being forced to take them?
When I met with Dr. Stephen Eschnauer of the Kanawha Charleston Health Department, he told me that many of the childhood vaccines administered by the United States have decades of safety evidence behind them. Then he asked me a simple question.
When you have a health issue, do you go talk to your politician or do you go talk to your physician?
As a parent considering vaccinations for my son, I remember hearing some of the claims against vaccines, that they can cause illness or contain dangerous ingredients. Chanda Atkins, who supports fewer vaccination requirements, says parents should know more about how vaccines are produced and tested for safety. That process is managed by the Food and Drug Administration, with input from a committee of scientists and healthcare providers. Dr. Paul Offit is a pediatric infectious disease specialist and serves on the FDA's Vaccine Advisory Committee. He also runs the Vaccine Education Center at the Children's Hospital of Pennsylvania and has even co-designed a vaccine himself for rotavirus.
How did you realize that you were going to specialize in infectious disease?
Well, the real answer is probably when I was 5, I was in a polio ward. I'd had a failed operation on a congenital deformity for my right foot, which landed me in a chronic care facility in the mid-1950s, which was a polio ward. I mean, I saw children in iron lungs. I saw children in traction, children being treated with hot packs that were excruciatingly painful. It was literally hell.
At that time, it wasn't uncommon to know a child who'd become seriously ill, disabled, or even died from a communicable disease.
Pertussis or whooping cough would cause 8,000 children to die every year. Diphtheria was a common killer of teenagers. Polio would cause as many as 30,000 children every year to be paralyzed and 1,500 to die. Pneumococcus would cause thousands and thousands of cases of meningitis and bloodstream infections and pneumonia, again, and causing hundreds and hundreds of deaths. Because of vaccines, we live 30 years longer than we used to.
How has the process of approving and evaluating the safety of these vaccines changed, say, since the 1800s?
Dramatically. Frankly, it's changed dramatically since the 1960s. The bar is very high for licensure by the Food and Drug Administration and recommendation by the Centers for Disease Control and Prevention.
These days, the whole process starts preclinically, as in studying how a virus works, and then testing your theory with initial experiments on animals in a lab.
As kind of proof of concept, proof that you have the right strategy for how to make a vaccine, the right quantity in the vaccine, the right dose, the right number of doses, the right spacing of doses, and then you do small phase 1 trials in people.
That could just be a handful of people, fewer than 50.
To make sure there's not any obvious problem. Now you think you've got the right dose, you think you've got the right dosing interval, you think you've got the right number of doses, then you go to phase 2 trials, which is in hundreds of people, to make sure you don't have a common serious side effect problem. Then, assuming that's all true, and you think now you've got the right strategy, the right dose, the right number of doses, and there's not at least a common side effect problem, then you do tens of thousands of people, often 50, 60, 70,000 people, to prove that the vaccine works and prove that it's safe, at least at a certain level of comfort.
That's when a vaccine is released to the public, but regulators continue to monitor its safety.
So you look at very quickly who's gotten the vaccine, who hasn't, so you can tell whether or not there's a serious side effect problem that's much rarer. That whole process takes about 20 to 25 years.
And the length of that process is mainly due to bureaucracy. It takes years to put a new vaccine on the market. But we all remember how quickly that process can happen.
Good evening, everyone. We're coming on the air with breaking news. The Food and Drug Administration has just approved the first COVID-19 vaccine for use in the U.S.
That was solely funded by the government. It's the so-called Operation Warp Speed, which existed under the Trump administration.
That's when lawmakers shelled out $11 billion for the project.
Basically, the government took the risk out of it for pharmaceutical companies.
Normally, companies pay for phase 1, 2, and 3 of the clinical trials, but this time, Congress wrote an unprecedented check.
They paid for the buildings, they paid for the manufacturer, and it all happened very quickly so that even if the vaccine was shown, for example, not to work in a phase 3 trial, the government still paid for the vaccines, even if they had to be thrown away. So that's why we were able to make a COVID vaccine in 11 months, which was the fastest vaccine ever made, because it was an $11 billion effort by the government.
How did evaluating and recommending COVID vaccines compare to previous processes you would have been a part of on that committee?
Much more harrowing, that's for sure. I mean, so think about it. You have Pfizer, for example, did a 40,000 person prospective placebo-controlled trial, meaning, 20,000 people got the vaccine. For Moderna, it was 30,000, so 15,000 people got the vaccine, which meant that by the end of December, you had data on 35,000 people who'd been vaccinated with a novel technology against an unusual pathogen. You know that you've made a recommendation for vaccines that are going to be given to hundreds of millions of people. And you know the other shoe is going to drop, because it always does. When you make those decisions, you're not making them because you know everything. You're making them because you think you know enough. But once you get into hundreds of thousands and millions and tens of millions and hundreds of millions of people, you may find, and often do find, and virtually always do find, a very rare vaccine adverse event or side effect. And with the mRNA vaccines, it was myocarditis, or inflammation of the heart muscle, which occurred in about 1 in 50,000 people. So you're not going to pick that up in a 30,000 person trial. And then for the Johnson & Johnson vaccine, it was clotting, including fatal blood clotting in the brain, which ultimately drove that vaccine off the market in March of 2023. And that occurred in 1 in 200,000 people. Again, you're only going to pick that up post-authorization in this case. And the good news is there's systems in place to pick it up. But I think the public never understands that.
If anything, Dr. Offit thought the COVID pandemic and the successful vaccine response would weaken criticism of vaccinations.
What some of the anti-vaccine activists would say is, I don't need these vaccines. Why do I need a polio vaccine? Why do I need a diphtheria vaccine? Give me a real pandemic. All right, this was a real pandemic. Thousands of people were dying every day, and there was nothing you could do about it other than trying to avoid human-to-human contact for a virus that could be spread asymptomatically, meaning anyone you came in contact with could potentially infect you with a virus that could kill you.
The committee reviewed massive amounts of data for the Pfizer and Moderna vaccines.
800 pages of data, and I can promise you I read every word of all these studies, the details of all these studies. I couldn't wait to get vaccinated. I would say I was an informed person about getting that vaccine and could not wait to get vaccinated, and assumed other people would feel the same way because it was all we had. Here you had a novel pathogen, SARS-CoV-2 virus, which had unusual biological characteristics, unusual clinical characteristics, that we were now going to meet with a vaccine strategy, messenger RNA, that we'd never used before. I think it was honestly the single greatest medical or scientific achievement in my lifetime.
However, the scientific success of a COVID vaccine has not been a complete public health success. That's coming up after a break. You're listening to Us and Them. This program is supported in part by the West Virginia Humanities Council, the CRC Foundation, and the Daywood Foundation.
Music lifts us up and brings us together, even when we can't get together in person. Mountain Stage brings you live performances on the air, online, and in our podcast. They remind you how it feels to be in a live audience listening to live music. This is Larry Gross, host of Mountain Stage. Find a link to our stations and our podcast online at mountainstage.org.
It's Trey, and this is Us and Them from PRX and West Virginia Public Broadcasting. Dr. Paul Offit, who serves on the FDA's Vaccine Advisory Committee, says when the first COVID vaccines were made available, he couldn't wait to get his. However, many Americans didn't see it that way. They saw a rushed process and news that was too good to be true.
I think with sort of internet access, with the flood of misinformation and disinformation on social media and the internet, people feel they know just as much as anyone who's giving them advice.
As the rollout to the vaccination came out, we were in the middle of a presidential campaign year. And I'm just curious, how did political pressure factor into the process, or did it?
Massively. Remember, we had nothing in 2020. It was a belief of the Trump administration that hydroxychloroquine would treat or prevent COVID based on nothing, based on just a few doctors saying they think it would work. So the government bought 29 million doses of hydroxychloroquine, and they basically twisted the arm of the FDA to authorize its use or to allow its use. And so over the next 3 months, when studies were done showing that it didn't work to treat or prevent COVID, then they withdrew that authorization. So you had 3 months where the Food and Drug Administration, which is responsible for making sure that they stand between the pharmaceutical companies and the public to make sure we get products that are safe and effective, had basically allowed itself to accede to the wishes of the Trump administration to allow this magic medicine, which wasn't magic at all. That worried people. That worried people about vaccines. So as a consequence, many states formed their own vaccine advisory committees. They didn't trust us. They didn't trust the FDA Vaccine Advisory Committee because they thought we too would have our arms twisted. And where this came about importantly is that whenever you have a vaccine trial, you have to wait till 2 months after the last dose to make sure that there's no safety problem, because when there are safety problems, they invariably occur within a few weeks of the dose. That was true with myocarditis. It was true with this blood clotting with the J&J vaccine. You have to have a 2-month safety follow-up. Well, the 2-month safety follow-up for those vaccines put you into December. There was an election in November. The Trump administration again tried to twist the arm of the FDA to release those vaccines early. People were very upset about that. But to Stephen Hahn, who was the commissioner of the FDA at the time, stood up and said, no, we aren't going to release these vaccines until we have a 2-month safety follow-up. And we did, and we benefited from that.
And on the campaign trail that year, candidates openly politicized the rollout of the COVID vaccine.
We've done an incredible job in speed like nobody's ever seen before. This could have taken 2 or 3 years.
If the Trump administration approves a vaccine before or after the election, should Americans take it, and would you take it?
If the doctors tell us that we should take it, I'll be the first in line to take it. Absolutely. But if Donald Trump tells us that we should take it, I'm not taking it.
There was a lot of political machinations that were really hard to watch. In August of 2021, President Biden got up in front of the country and said, we are going to offer a 3rd dose of the COVID vaccine. Now, at the time, protection against severe disease was holding up and clearly held up until Omicron came into the country, which was months later. So where did that come from? He just sort of declared that we're going to have a 3rd dose. He went around the FDA, he went around the CDC and declared that. There were people at the FDA, senior people at the FDA, who quit when he said that because they didn't like it that he'd chosen to make this declaration unilaterally. I felt like the way that people who I have known for decades and loved, I felt like they felt that because we'd made this roughly $3 billion purchase of these bivalent vaccines that we had to support them unequivocally. And I called them and we talked about it, and I just sort of got the sense that the train had left the station. But the sense at the time was, because there was such division in this country, that if we looked like we were unsure among ourselves, that would even create greater division. You sort of felt like you were on the bus or off the bus. I mean, I wrote an op-ed in the New England Journal of Medicine saying that I don't think these bivalent vaccines are any better based on immunological studies that was published. And then that ended up with me being on CNN. And they showed a clip of Ashish Jha, who's great. He's a COVID response coordinator. And he said, got to get these vaccines, they're better. Then Pamela Brown at CNN turns to me and says, is he wrong? Which is not the question you want to answer. As a scientist, that was all very hard for me. It was a little bit of a loss of innocence.
I actually watched that CNN interview about the bivalent vaccine. In it, Dr. Offit said something that reminded me of Emily Rice's interview with Chanda Adkins. He said, if there's no clear evidence of benefit, it's not fair to ask people to take a risk, no matter how small. In that moment, he felt the government was advocating for a health intervention based on political calculus instead of good science. Data eventually showed the bivalent vaccine, as in built against 2 COVID strains, did provide continued protection against the virus. Ultimately, vaccine companies went back to making COVID shots from 1 strain. Since that time of back and forth advice, he feels some conversations with families about the safety and rare risks of vaccination have become harder to navigate.
People are much quicker to see conspiracy, to believe that there are these dark forces working behind the curtain that people don't see, but now they see, and they don't trust you because you basically are one of those darker forces. You're part of this deep state.
And it's very sad because that distrust has led to a lot of poor outcomes.
That's Stephen Eschenauer from the Kanawha-Charleston Health Department.
Seeing a number of patients that have delayed follow-up with physicians since COVID and now have very bad outcomes, discovering, say, cancer much later, not getting a colonoscopy or an endoscopy or a follow-up mammogram, whatever the test may be, pap smear. It's so important to do a little health maintenance, especially if you're at risk. And people became distrustful of health care, and it's very distressing.
The internet makes it easier than ever to find horror stories behind any treatment or procedure out there. But I'm not sure I buy that's the only factor behind changes in American healthcare habits. Again, historian Elena Konos from UC Berkeley.
So to me, social media is part of the story, but it's not the entire story. To me, what's going on today is a larger and more widespread version of what we've seen at many points in history, especially the history of vaccination. What I do worry, however, is that we believe social media itself is the problem rather than that social media is allowing many radical or problematic views to spread, undermining some of the just basic forms of trust that have served our nation well in the past and have been eroding in recent years. And that loss of trust, often, I think, historically and in the present, has led people to question things like vaccines.
But frankly, Americans have been losing trust in vaccines for decades. At the same time, American healthcare has changed dramatically. Half of Americans today struggle to pay for their health care. The care they do receive is increasingly consolidated under large health networks. And with chronic illness on the rise, those shifting systems are more strained than in previous generations.
I think when you look really, really closely, the story gets more and more complicated. People lose trust for a variety of reasons that are structural. Everything from, say, something that could be a particular encounter with healthcare to a particular encounter with a toxic exposure in their town, or a company whose products later turned out not to be safe, or a drug that they were prescribed that was later pulled off of the market. We have so many of these stories. We have a media environment that circulates these stories. We today have a political environment and a social media environment that encourage people to kind of come down on, quote, one side or another of these issues rather than seeing them in more complicated ways. And I think all of that has fed into mistrust of vaccines.
For many, the idea of an adverse vaccine reaction is easy to brush off. That's because health experts say for many, vaccinations do carry minimal risks. It's far easier to push back against vaccines when you've had a bad reaction to one. My colleague Emily Rice asked Chanda Adkins with West Virginians for Health Freedom about why she changed her views on vaccination.
She said that she actually developed some of her views while she was in school to be a pharmacist. Because they were required to get so many vaccines, she had an adverse reaction to one. And that's actually what inspired her conviction about this.
I received a hepatitis B vaccine and was injured, and it was a physician who told me this. I'm trained, I'm a WVU grad from 2005, and no one ever told me that this was a thing. Adverse events can happen. This is how you take care of it. That's more the tragedy than even that something happened to me. But it was because of that traumatic event that I experienced. That's when I was able to understand and listen. There was an episode on the Brady Bunch where Marsha Brady had the measles and stayed home and ate ice cream. That's what we get so fearful about. And so the other thing I would say is most of the parents, they know the diseases, they understand the diseases for which they're vaccinating for, and you have to be able to assume the risk. Is it okay that I get the disease and I can deal with that and I'm healthy enough to be able to overcome that? Or on the flip side, is the vaccine going to be okay for me and not cause any injury? If you don't believe injuries are real, then you have no issue with that. But if you know injuries are real, Would I be concerned for my children? Of course I'm concerned for my children, right?
Dr. Paul Offit with the FDA's Vaccine Advisory Committee says the trade-offs are complicated.
Knowledge about medical products is always associated with a human cost. Take your pick, antibiotics, anesthetics, gene therapy. There's always a human price paid for knowledge, and I just don't think we ever accept that. We think that we always know enough that that would never happen, when it always happens.
As we produce this story, that exact idea, the human cost of public health, surprised me. Elena Konis told me a story about how in the 1980s, a self-described vaccine safety movement started working with the FDA and the American Academy of Pediatrics.
They were concerned about exactly this human cost. Their members had accessed medical literature that showed that, oh wait, no, there are risks of the pertussis vaccine. We were being told to vaccinate our kids, and we weren't being told that some of our kids were going to be harmed by the vaccine, even though doctors knew that. They were outraged, and they took a slogan that actually health professionals had come up with, I believe in the 60s. Health professionals were trying to get the American public to vaccinate against diseases like measles and mumps by saying, even if the chance of complications is 1 in 1,000, when that one is you, the chances are 100%. Vaccine critics later took that and flipped it around and said, if the chance of a vaccine injury is 1 in 1,000, when it's your child's chances were 100%. One thing that really played an underexamined role in the loss of trust in vaccines has been the fact that the public has felt like they had to surface vaccine risks or safety concerns themselves and couldn't trust public health or medical professionals to be honest about them. Personally, one of the things I've found frustrating about all of our conversations about this topic, it's so easy to call people with vaccine worries anti-scientific, but it just shuts down the conversation, and that doesn't help anybody. Some vaccines do have risks. There are even vaccines whose risks we don't perhaps fully understand, or we're still coming to understand. But in a society that has prized individualism for centuries, how do we talk to the public and say, yeah, there's more benefit than cost, but somebody here is going to have to bear the cost of keeping the public healthy?
At its core, our public healthcare strategy is designed to help not just the few, but the many. In reality, our healthcare system has plenty of faults and gaps. Efforts to weaken West Virginia's vaccination requirements are framed as a movement against current regulations to protect the few who might be harmed by a vaccine. Is it possible to protect a population with a vaccine and meaningfully address the few who might be harmed?
Does that make people trust you more or less? Because now they think, wait a second, that they got this all wrong. How do I know that they're not always getting this wrong? I don't know. I'd like to think that the transparency in that would make people trust us more, but I might be wrong.
What we do know is that in places where laws get loosened, rates of infectious disease with some dangerous long-term effects go up.
Measles causes a disease that has the long name of subacute sclerosing panencephalitis, or SSPE. It occurs usually years after your original measles infection, and it causes a gradual deterioration in personality, and then you start to lose functions like motor functions, sensory functions, and then you invariably die. There is no treatment for that. You just watch a child sort of fall off a cliff in slow motion, and there's nothing you can do about it. Polio also can cause post-polio syndrome, which is a deterioration as you get older. Influenza can be fatal. The frustration in medicine is there's so much in medicine that we don't know. There's so much we can't do. That to work at a children's hospital and see children come in whose parents chose to put them in harm's way, and now they're suffering and occasionally dying from that choice, is just very hard to conscience.
Dr. Stephen Eschenauer says when he talked with lawmakers about the proposal to drop some of West Virginia's vaccination requirements, most were not thinking about health outcomes.
What I always wonder about when I talk to legislators are, do you grasp the concept of action, consequence? Have you really thought through what's going to happen in the future when you pass this? And I can honestly say that most were in denial. Oh, it won't change anything. We don't have measles here. We don't have mumps here. We don't have polio here. People want freedom, but freedom always comes with a fee. What are you willing to pay for it? What are you willing as a society and as an individual to pay for it? We have the laws in our system now. Why? Because it's about the community first. All of our laws create this system that we have here to create a stable, safe, and an environment that allows everyone to live in some peace and harmony.
The fight to remove vaccination laws in West Virginia is not over. Again, West Virginia Public Broadcasting's Emily Rice.
I don't think it's going anywhere, and neither does anybody. Dr. Lisa Costello at WVU Pediatrics comes to mind when I asked her, what do you think will happen next session? Do you think we'll see this again? She said she really doesn't doubt at all that she's going to see it again and that they are ready to come together as physicians and put together the same kind of letters and petitions that they did the last time. The makeup of our legislature is changing a lot more than I think anybody really expected. I do think we are going to see a lot of the same conversations, and we could only hope that we could also get some stuff done in between.
And there's going to be a different governor.
Yes, exactly. There will be a different governor with his own choice whether or not to veto. And Justice did wait until the very last day to veto House Bill 5105.
You've been listening to Us and Them. Our team for this show was me, Trey Kay, Christina Stella, and Kate Smith. Special thanks to Julie Blackwood and Lelena Price of the Kanawha Charleston Health Department. Michael Lipton, Tristam Lozow, and Ahmad Solomon wrote and performed the Us and Them show music. Mark Lerner designed our logo. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting, the West Virginia Humanities Council, the CRC Foundation, and the Daywood Foundation. Hey, we'd love to hear your thoughts about this episode. Would you share them with us on our Facebook page or on X, formerly known as Twitter, at Us Them Podcast? Us and Them was originally developed with assistance from the mentorship program at AIR, the Association of Independents in Radio. We hope everybody is staying healthy this fall, and we'll see you next time on Us and Them.
Support for this podcast comes from the Corporation for Public Broadcasting.
From PRX.